Hello everyone, my name is Dr. Nadia Ali and we are actually going to be discussing a very important topic called osteoporosis. So when we are thinking about osteoporosis, our typical imagination of someone who has osteoporosis is that of an elderly lady who's hunched over, but that is not really the case because a lot of times it will be very difficult to be able to identify a person with osteoporosis because they will not actually have physical signs to tell them that they have osteoporosis. Approximately 10 million Americans have osteoporosis, and another 44 million have actually low bone density, which is called osteopenia, which puts them at a very high risk of developing osteoporosis. 1 in 2 women and up to 1 in 4 men will actually break a bone in their lifetime due to osteoporosis. For women, the incidence of osteoporosis is actually greater than that of heart attack, stroke, and breast cancer combined. It is very important that we understand what this condition is and what are some of the reasons that we actually get in trouble with osteoporosis, and most importantly, how do we prevent it since it is such a highly prevalent condition. So let's start off by talking about what is osteoporosis. So osteoporosis is a bone disease. There are 2 types of cells in the bones. One are called osteoblasts, which are bone-making cells, and 1 are osteoclasts, which are bone-breaking cells. And in the condition called osteoporosis, the activity of the bone-breaking cells, or osteoclast, is higher than that of the bone-making cells, which are osteoblasts. And the result is that the bone becomes very porous, which means that the quality of the bone reduces and the density of the bone reduces. And that is a very unstable condition in which the patient can actually fracture the bone with a minor trauma. So osteoporosis increases the risk of bone fractures. And bone fractures have a very high risk of developing complications, which includes death, which includes development of clots, which includes infections, so on and so forth. So this is a situation which predisposes an individual to high risk of complications. It also means there is going to be a poor quality of life. It will affect the mobility of that person as well. So this is a condition which has a very high cost associated with it. So the next question we will be asking is, are you at high risk for fragile bones or osteoporosis? And so the risk factors for osteoporosis are low body weight. So if you are somebody with low body weight or having a difficult time increasing your weight, you are somebody who actually may be at risk for osteoporosis. The second and very important variable is poor nutritional status, which means that your body does not have adequate nutrients to support the bones. And this is particularly prevalent in people who have digestive issues, which lead to their inability to absorb the nutrients that they actually need for the functioning of their body, including their bones. The third and very important risk factor is smoking and alcohol consumption. So if you have osteopenia or you are at risk of osteoporosis, it is recommended that you avoid these. The next very important factor which predisposes to osteoporosis and osteopenia is inflammation. Any disease which is a result of inflammation, such as autoimmune diseases, diabetes, chronic kidney disease, puts an individual at a high risk of osteoporosis because inflammation actually directly inhibits the ability of the bones or the cells of the bones that make the bone negatively. So if you have any of those conditions, then you may be at high risk for developing osteoporosis. Last but not least, lack of exercise definitely predisposes us to osteoporosis. So one of the questions that's often asked is bone density versus bone quality. And the answer is that both of them are very important. The health of the bone is associated with the mass, but also its density and architecture. Now we come to what can we do in order to prevent osteoporosis and or osteopenia. The first and foremost thing we have to do is we want to make sure that we are consuming adequate protein. And when we think about protein, we're often thinking about meat. However, having said that, we have to understand that certain forms of meat are actually inflammatory and may increase the risk of osteoporosis. And so you have to be careful about the kind of protein you choose and how that will affect your bones. The second and very important variable is vitamin D. And so it is important to look at your levels of vitamin D and to supplement it in order to make sure that you have adequate vitamin D. Vitamin D should always be taken with vitamin K2, which also plays a very important role in osteoporosis. Third, and very importantly, we have to make sure that the gut health is taken care of because that is where your supply of nutrients comes from, and that is critically important for the formation of bones. The fourth and foremost thing that we can do is to avoid smoking, alcohol, as well as other toxins. Toxins have a tendency, at least some of them, can actually get stored in the bones and cause inflammation, which can affect the ability of the bone to create good quality of bone tissue. Last but not least, keep a healthy weight. You need to make sure that you have adequate distribution of lean mass or muscle mass and fat mass. Both are very important. So one of the things we can do is to do what is called body composition analysis. Body composition analysis that we do in our office helps us determine what is the percentage of lean mass that you have or muscle mass that you have, what is the percentage of fat mass that you have, what is the percentage of water mass that you have. And it helps us understand if you have adequate lean mass, fat mass, and water content. And on the basis of that, we can customize your diet to make sure that you have adequate quantities of each. In addition, if you're not able to gain weight, that itself is a concern because clearly there's something going on which is affecting your ability to gain weight, and that needs to be investigated. Last but not least, hormones play a very important role in the formation of bones. And we know that in women, menopause actually increases the risk of osteoporosis. And so it is important that if you have hormonal imbalance, that is taken into consideration and that is taken care of for women to not have to go on to develop osteoporosis. So osteoporosis is preventable and osteoporosis is reversible. And there are a lot of things in addition to what we have talked about that can be done to improve the quality of the bone and bone mass. Hope to talk to you guys soon. Take care. Bye.